Welcome to Hope for Med.
Hope for Med.
Welcome back to the Hope for Med podcast. I am your host, Dr. JB, and today's featured guest is nurse practitioner Marina. She is a COVID-19 nurse practitioner that worked crisis when the pandemic first started and has struggled with mental health and PTSD. Now she's working primary care and wants to share her story. Welcome to the show.
Hi. It's nice to meet you.
I'm so happy. I'm so excited to hear your story. So let us start from the beginning. Please share with my audience your origin story.
So I like origin as in
To healthcare.
So I was actually a psychology major and my grandmother got really, really sick and she ended up going to the ICU. And I remember being maybe 18, 19, taking college classes, really gung-ho about doing psychology. And I remember walking into her room because she was in the ICU. And I remember just having this overwhelming feeling of not liking the way the lines, this sounds silly, but the lines that she had going to the IV bags and stuff, I didn't like how they were tangled and disorganized. And she hadn't been repositioned at all. And she looked so uncomfortable. And there was no nurses around really to talk to. So that kind of put the spark in me to change career paths and go down the nursing route, which would make me the first nurse on both sides of my family to graduate with a bachelor's degree and a master's degree. Then after that, I went straight into ICU right after I graduated, after she had passed away, because I felt like I was supposed to be there. And I spent maybe 6, 7, 8 years in ICU and trauma. And I floated to the ER a lot. And then I graduated nurse practitioner school right around the pandemic. And that's when things got a little spicy.
Right? Okay.
Got real spicy. So, I mean, do you want me to go into COVID? Are we ready?
Yeah.
Are we free falling?
I'm following.
We're going to free fall into the COVID crock pot. Here we go. So I had just graduated nurse practitioner school and I was totally fine staying in the ICU. I really didn't want to go anywhere. I was comfortable. But we started getting these patients in and we didn't know as healthcare workers what to do. Here's something we've never seen before. How are we going to fix it? There were days where, and this is the majority of my days, unfortunately, when I was just in the ICU as a standard nurse when this first started, I was wearing the same mask for weeks on end. If I wanted another N95 mask, I'd have to call my house supervisor, which I was refused a new mask no matter what happened to my old one. And I wore the same gown and it was really scary. I remember coming home and nobody wanting to be around me at all because they didn't know if I could get them sick. So that had to probably have been the loneliest time in my life because I didn't have any family around and I didn't have a boyfriend or a best friend. It was just me. And God forbid I go to the grocery store with my scrubs on to pick up a microwavable meal without getting dirty looks just to get food. So I ended up having to get my groceries delivered. I got to a point where I didn't want to be on the floor anymore and I wanted to pursue being a nurse practitioner. I ended up taking a COVID crisis contract in Albany, Georgia. And that's when things got really, really spicy because I was a brand new nurse practitioner and here I am going into, I don't know. You know what I mean? What am I going to face against? How am I going to handle this? Who's going to talk to me? It was incredibly lonely, but I felt like I was supposed to be there. Like I had a calling to be there. So I ended up going to the hospital there. And I remember hotels refusing to take me because I was a COVID nurse practitioner. They didn't want to be anywhere around it. So I ended up staying in a dorm room about 10 minutes away from the hospital. They put all the nurses and the doctors in a dorm room and it didn't matter. They didn't care whether we could have been sick or not. They just piled us in there and kind of crossed their fingers. And that was a really daunting experience to sleep on a really small, tiny dorm room bed after working a 13, 14-hour shift and kind of no one, I just remember being really lonely. It's the only thing I can tell you. Because like, even though you have a roommate, your roommate's going through it too. So my roommate's coping mechanism was to drink after work. Mine was just to lay face down in bed, like cry. So I was there, and it wasn't bad. It was kind of the same thing, but people were dying left and right, and there was nothing I could do. You hear a code button go off, and you're running over there just to run over into another room, and the same thing's happening. People can't keep their saturations for their oxygen up. You got doctors yelling at you. They don't care that you're a mid-level. Like at this point, you better put that order in for me or else. And a lot of the times I would come home, and I think the hardest thing for me was I felt responsible for my patients who passed away. And because I feel like, and I've never told anyone this, like I feel like I promised them, like it wasn't the typical mid-level, I was still a nurse inside. We all are. And I remember just going in there and holding my patients' hands all the time and telling you, it's going to be okay. You're going to be fine. You're strong. You can get through this. And then they would die. And I felt responsible. And, I don't feel like anybody should feel responsible for something like that, because I did the best that I could do in the situation. I did every medicine. I talked to every doctor, and I felt responsible. And I still do. It still bothers me because I always question, like, what if I had done this differently? Or what if I had talked to this person or got a second opinion? But I guess it didn't matter. Once they're so sick, it's like, how do you go backwards? So it was like that for a while. And yeah, I was so in the moment. I felt numb to the entire situation. It's like you didn't feel anything. It was like you were living in this tunnel, and you're just kind of existing. You have no feelings at all other than just numbness. And then the day came where my patient, who I loved very much, I had been with her for quite some time. She ended up coding, and it still haunts me that when you have all that equipment on and you have the negative pressure rooms and all of that, it's hard for people to hear that you need help. I remember hitting the code button, and we were so short-staffed that all the staff members couldn't hear the code because they were all in another room. So I was coding and bagging a patient by myself. And it took them 5 minutes to find me. And I didn't want to leave the patient. I kept yelling out the door for help. And it was like, I look back at it now, and I'm pretty sure it's the worst feeling I think I've ever felt in my entire life, because that was somebody's mom. And I know that she was sick, and I know that there was nothing else I could do. We did everything. But the one thing I always kept doing is I'd open up the windows after they passed away, thinking that their soul would go out the window and they would be free from all the pain and the suffering that they went through. This happened so many times with patients dying on my shift that one day I had enough. And my patient, again, up and awake, I'd taken her outside. We established the sunshine protocol because of me, which is when we would take our patients outside to see the sun if they were healthy enough, or at least a little bit better, so their loved ones could drive by or they could see the sun. And I had taken my patient out there to see the sun for the first time in 4 months. And she looked at me and she said, "This is the most beautiful thing I've ever seen in my life." And I looked at her and I was like, "It is, isn't it?" She goes, "Can I stay out here?" And I had her on high flow oxygen. Like I had her all propped up, and like we sat out there for a good solid 10 minutes. And then she passed away when I wasn't there one day. And it broke me. I think that was like the final straw. I ended up walking off the unit and I didn't return. And I've never told anyone that that's why I left. I came up with some reason that had an emergency. But the truth is that I was broken and I didn't know how to fix myself. Because how can you take care of someone else if you can't take care of yourself? Flash forward to the second year we were in the pandemic, and I was working urgent care, thinking that I'd escaped COVID. I didn't. I was seeing over 100 patients a day with COVID by myself. We were so short-staffed, over 100 for one mid-level. And the final breaking point at that job, because it turned into this money-making thing with people. Like they just wanted to get people COVID tested and charge them this and that and charge the CARES Act. It stopped being about the patient. It started being about how many can you see in a day? I had the most beautiful African-American woman come into the clinic. She was 94 years old. She was beautiful. And I felt this like connection with her the instant I met her. And she goes, I'm really not feeling well. And I said, okay, go wait in your car. I'm going to come out to you. You look tired and I don't want you exposed to all these sick people in here. So I go out there, I bring all the stuff with me, the vitals machine, everything, COVID swab, all the things. And her sats were 82. So we're trying to get oxygen out there and she's scared. I'd already had COVID, so I didn't care at this point. I crawled into the passenger seat with her and I held her. And I sat her up and we laughed and talked and giggled, and EMS finally got there. I was the last conversation that she had with somebody. She died on the way to the hospital. And, I don't need to cry, but it's like, I've never shared it, obviously, publicly about how much it's affected me, but it's like I still feel guilty. I could have done more, but I think the thing with COVID is it doesn't care who you are or what you look like. And I think that the aftermath of all of it is that nurses have, and medical doctors, everyone across the board, all the way down to environmental services, everybody has taken a beating in healthcare, the worst beating of our lives, and we're tired. And now we're kind of stuck in a place where we're like, how do we recover from telling somebody that they're not going to make it, or telling the wife of the husband of 50 years that her husband's dead, but she can't see him. How do you move forward without beating yourself up or dwelling on it? And that's kind of where I am. And I've never shared my story. I just haven't, because I think I've been embarrassed that I've been emotional about it, because I'm supposed to be strong in my career. But I don't feel like it. And I feel like it's taken a really huge part of me. I can't even hear a zipper on a bag without immediately wanting to cry, because I've zipped so many bags up of people who are no longer here. So my whole point of talking to you today was to, one, share my story and let people know that it has affected us. And it still affects us, even though it's slowing down. It doesn't matter. But I think there needs to be some changes with staffing. And there needs to be some changes with not capping anybody's pay, or hearing people say, we let you keep your job during the pandemic. That was your reward. We're more than that. And maybe I'm wrong, but I don't think I am.
Marina, first and foremost, I want to say thank you. Thank you for sharing your story. As a fellow healthcare professional, it's hard to hear these stories, because just like you were crying, it made me emotional.
I'm sorry.
No, it's fine though. It's fine because we need this space. We need this place. That's why Hope for Med was created, was to allow us to have these conversations. Because we're not heroes. We're not heroes. We are human beings with human emotions, with human reactions. I'm an emergency medicine physician. So when you're telling me your experiences of seeing patients dying, of being the last person to hear their voice, of patients looking you in the face before you intubate them, and the last words they say is, please don't let me die. And then they die. That's so traumatic. Because you start thinking, what could I do differently? You know, what I promised this patient that I was going to do, that everything was going to be okay. You're never going to tell somebody, oh, everything's not going to be okay right before you intubate them or do anything like that, right? Because you need them to be hopeful. So we're going to say everything's going to be okay. Even if we remember that 5 minutes before, the patient next door to you just died. And that the possibility of you being okay is small, but it's not zero, right? And so when they are not okay, then there is these feelings of guilt of, what could I have done differently? If I was only there 5 minutes before, would it have done anything different? If I wasn't off that day, if I was just present, would that have done anything different? And truthfully, the answer is no.
I think that's just hard to accept. And I think the other thing that really bothered me is when we would have COVID outbreaks in the jail, that they would keep the patients shackled to the bed even after they died. I remember very vividly at a patient who was in jail for something very bad that someone would say unforgivable, but they had him shackled to the bed when he was no longer with us. And I remember begging the security guards to let him be free. And they said, it's not our problem. He's a product of this. And I remember covering up the chains with blankets and towels. I don't know why. I just didn't think that anybody should die like that. I didn't think it was fair. At least let him go with dignity, no matter what. Every patient deserves love and dignity. And I left the window open for him, and I'll never forget this. I took him downstairs to the morgue with the charge nurse because we were so short-staffed. Like we got to help. We were a team at this point. And we had run out of room in the trucks for patients. And we had a storage unit with a mini fridge in it, some kind of like refrigeration device. And they had built slats in. I remember having to physically pick him up and put him in there. And then it was raining and I had to walk across the street to do it, like to bring him over there. And I remember it just being so quiet on the way over there. No one said a word because I think we were just so numb. And I think they knew how much it bothered me that even in death, he was imprisoned. Like you couldn't even take the shackles off this man. He has a family. But am I wrong for that? Am I wrong to think that in death, people deserve to continue to be shackled? Like, I don't feel like I am. I don't think he deserved that. I really don't. And that bothers me too.
Have you been able to talk with anybody, any of the people that you were working with during that time period, or even now? Have you been able to have any semblance of a conversation like we're having?
You know what? Not really. No one wants to talk about it. And I don't blame them. I think what we try to do is like carry on, like nothing happened. Like, this is just part of a job. It's life. We continue forward. No big deal. There's one person I feel like that I am able to talk to, and that's my former roommate, Corey, from when we were travel nursing together. And he worked PICU, so he was seeing kids with COVID. However, he will only share 30 seconds of what he saw because he can't handle it. And because of all of this, he's permanently left the bedside as a nurse. He will never return. Not even as an NP. He's almost done with his NP. He will never return. And I will never go back to a hospital. I will never set foot in a hospital again. I refuse. And I know that's bad, but I am traumatized. It's like you get to a point where you're like, all right, well, now what? That was bad. It's just like a scabbed over wound at this point. But I think that people need to start coming forward in healthcare and talking about this, because our mental health matters too. And I have a therapist, and it's been like her hammering me every week to get me to talk about it. Sometimes I can say little things like I've said to you today, and other times I can't say anything and we just stare at each other. So it's like, it takes time. It doesn't happen overnight. But this is the first time I actually shared my story in depth. And it's very freeing, but I can say on a lighter note that sharing our stories with other healthcare providers and doctors and nurses, everybody, it's very healing, because we're not alone anymore, like we felt when we would come home. And I think that's the biggest thing I want to get across is I don't want anyone to be afraid to share their story about working COVID, and that you're not crazy, and that it's okay to cry about it. It's okay to love patients so hard that when they pass away, you're upset too. That's allowed. Should never not be allowed, because we love them too.
And because we're humans and we're surrounded by so much suffering, like, we're not robots.
No. And I don't know why people think that we are, because it's like we're expected to like show up, we're ready to handle the day. No matter what it is, you'll be fine. But it's like, you and I are not robots. We have very powerful, vibrant, loving souls. Even though we contain ourselves in the moment, when a patient passes away or things are bad, when we go home, it's like you fall apart. You just do. But I think falling apart's okay sometimes, because then you get to put yourself back together and start over.
I think it's important to be able to have a place and a space to release.
Absolutely. And I want to get to a point, I feel like, in healthcare where people can take 10 minutes to regroup for their mental health, no matter what. And that means everyone, from top to bottom. Every single person who sets foot in that hospital needs 10 minutes to breathe. And I don't know why we, as a society right now, don't think that's okay. Because I don't know any nurses right now, or physicians, or environmental service people who are getting breaks. I don't see it. You know, you clean one room, now we need you to go clean the other room now. She has a family too. He has a family. Like, they need a break. So there has to be a change. And we need to start talking about it. And we need to start sharing what we've been through as a whole, as a community in the pandemic, because it hasn't been so black and white. And people are having a hard time. I can tell you the majority of my primary care patients now are nurses having all these health issues now because of COVID. Back problems, depression, PTSD, you know? And I've made it my life mission, I feel like right now, to have a service line for those people, because there's just not enough of it. And I don't care if they don't have insurance. The other thing, not all insurances are really covering the bulk of what people need to be mentally healthy. That's just kind of where we're at. I don't know how you feel about it, but I mean, that's how I feel about it.
Well, I am completely aligned with how you feel about it. That is why Hope for Med was created. Like, I can't stress that even more. Hope for Med was created because we as healthcare workers are dying. We're dying literally, high suicide rates amongst us. And
it's bad. I had former nurses I worked with in Florida who are no longer with us because of COVID, and they decided they didn't want to be here anymore. And that's tough. And we are dying. And that's not a happy thing at all. I don't want this to keep going. I want people to be able to talk about it, come up with solutions, and understand that good medicine is still here, but we're all just having a hard time after getting hit for 2.5, almost 3 years now. I mean, we're still seeing cases, and I'm still treating patients post-COVID with long hauler. And just it's hard to, like, I feel like now I definitely am. I still like go back and think about all the things I coulda, shoulda, woulda. But I try to think about it more constructively, as in, well, if I would have done that, would it have changed the circumstance? Probably not. But did I make them really comfy before they went? Hell yeah. People were yelling at me to get out of the room and that there's nothing else I can do, just be done. No, I sat there. Even if they weren't a full code and they were on comfort care, I pulled up a chair in my PPE and I sat there. You're not dying by yourself today. Sorry. I'm going to hold your hand before you go. And you know what? Maybe I put myself at risk for getting COVID doing that, because I've been wearing the same mask for weeks, but I don't care. At least I can, if I did get sick, at least I would know that I was doing what the universe and whatever you believe in would want me to do. And that would be to love, no matter what. But I can say that I don't think I would be where I am now doing what I want to do if COVID didn't happen.
What do you mean by that?
I feel like it made me really, really strong, as painful as it was. Because now, like in my practice with my attending, there's nothing that I can't handle. I handle it with grace. And there's nothing and no one that'll turn away, because I'm just grateful that they're alive and breathing and being able to have a conversation with me. And that's something I wanted for so long. I actually opened a transgender care line at my office so people can get what they need without feeling judged, because I'm in the Bible Belt. So not a lot of providers want to help my friends, but I do. And I take everybody, every single person. And like, I will never change. I have kids that come in who are in foster care, and I pay for all their prescriptions and their visit. I don't care. because I think I realized that life is so short after working COVID, and that people just deserve to be loved because you don't know when your time's up or when their time's up. And maybe then I'll be judged for that. I don't care.
Judge for taking care of people.
I feel like, I know the last place I worked, it was like, if I paid for patients' prescriptions, it was like, why would you do that? Now they think that healthcare is free. I knew that wasn't the place I was supposed to be, for sure. But now being where I am, I just feel like it's a happy, beautiful place. But I also still struggle with certain things. There are some nights I don't sleep because I have bad dreams about what I went through. And then there are some days where I hear like a zipper of a bag and I immediately like just freeze in my place. And I'm just like, okay, I'm not there. That's not what you think it is. It's just a backpack. And I think it's crazy that sound like that can like put you back in that place again. I don't know if you've experienced that, but like certain alarm sounds for a while, like EMS sirens and stuff really bothered me. But I try to take each day at a time, as I'm sure you are too. But my main question is how do we get to a point? How do we get here? And when are people going to realize that I'm not your pandemic hero anymore? I'm a person. And a year ago, I wanted to die from what I was doing. Heroes don't die or want to die. So I don't feel like a hero. I feel like a human being. So I'm just glad I was able to share my story without reclusing into a hole for once, which seems to happen often. But
You know what I can honestly say about your story is that you're not alone. So many of us have gone through the exact same thing that you've experienced, have been surrounded by so much suffering, so much death, so many people dying all alone. And we're left to try to figure this out independently without a community. In our minds, we realize, of course, I'm not the only nurse here, or I'm not the only doctor.
yeah.
Like intellectually, we understand that.
Mm-hmm.
But, it's that being vulnerable with each other. That piece, there's not a space, or there hadn't been a space to allow for that.
And there hasn't. And I feel like there should be. Like, I feel like we need to be vulnerable. It doesn't have to always be black and white, down to business. Here I am. I feel like we should be able to take each other aside and be like, hey, do you have a minute? Can you have a snack with me for a second? There's some things I want to talk to you about. And it's a rarity to like find that right now, with the exception of maybe a handful of people. But like I said, I can't even get my best friend to talk about it with me without him completely breaking down, because he's terrified to set foot in a hospital again, because he's dealt with kids with COVID. So I can't imagine.
Mm-hmm.
I don't even want to put myself in his place. But I can say is that there has to be a shift. And I want it to get to a point where we can share stories with each other and also support each other and connect with each other. Because the one thing that I can tell you out of the past almost 3 years that has not changed in my heart, because I can tell you 100% that people don't just disappear when they pass away. They don't. There are too many weird things that have happened, like, that I can't explain. Like the job I'm currently at, I had nothing to do with it. It was that woman in the parking lot at the urgent care. She got me this job because the day she passed away is the day that the medical director texted me and was like, "Oh, hey, I saw you the other day at your job. You seemed really compassionate." I know it was her. You got my information from my boss and texted me, and I feel like not all like doctors and nurses believe like always that there is maybe an afterlife, but I think there is, because you can't tell me that someone who is so vibrant just disappears. Like, you can't.
Marina, I can't thank you enough for just letting your guards down and sharing. I mean, your story is so powerful. You were able to put into words your experience that many people have a very difficult time doing. Your story is going to touch the lives of countless others. And I am so fortunate that you felt comfortable to come on Hope for Med's podcast and share it with us.
I appreciate you listening. I really do. I feel like I've found a friend, somebody I can share this story with. But if anybody who knows somebody who passed away from COVID who's not in medicine, I just want them to know, if they watch this, that I loved them too. And that they may have not shown it in the moment because I wanted to support you, but I loved them too.
Yeah. Who says a doc can't rap? DOCTORJB. The greatest doctor to ever touch the mic. The greatest podcast ever broadcasted or pre-recorded. Come learn some. Each one teach one. I'm done.